companies, either listed, unlisted, as independent directors, but also enables them and empowers them as far as their professional learning space is concerned. So this data bank also hosts our initiatives on a learning management system where we have 49 e-learning modules on different aspects where we help the directors to serve more professionally and also enhance their effectiveness in the board practice. Then alongside that, the data bank also provides an opportunity to the members to self-test in terms of their proficiency level. Of course, this test is mandatory for those who are having less than 3 years of board experience, but even those who have more than 3 years of board experience can utilize that feature. Then there are other additional resources, and I'm very happy to say and share in last 5 years, it was launched, in fact, in December 2019 and will be maturing with its 5 years of age this December. We have more than 32,000 independent directors as members to this, and a large number of women leaders who are all constantly helping the corporate India and also the boards. We are very happy to welcome you. My name is Dr. Neeraj Gupta. I lead the data bank as well as the corporate governance and public policy vertical at Indian Institute of Corporate Affairs. I would like to, of course, you are a well-known name in the country, both in the health sector as well as in the corporate sector, as a founder and chairman of Narayana Health Group of Hospitals, which has now 40 healthcare facilities pan-India with a capacity more than 6,000 beds. But still, in the interest of the larger group, I would like to briefly introduce and will consume 2-3 minutes, not more than that. Dear friends, Dr. Shetty is a chairman of Narayana Hridayalaya. He's a cardiac surgeon of repute and a successful entrepreneur. He's a highly respected luminary for his ingenious ideas for reforms in the healthcare sector. The visionary leadership that he possesses has made a difference to the quality healthcare as well as affordable healthcare ecosystem within the country. Because of this, his initiative has well been captured by Harvard Business School and the Wall Street Journal, and the case studies are regularly referred. Dr. Shetty serves as a chairman, Board of Governors of Indian Institute of Management, Bangalore, chairman of Healthcare Sector Skill Council, and also a member of Health Insurance Consultative Committee constituted by IRDAI, the apex insurance regulatory body. Sir has also served as member on Board of Governors of Medical Council of India and a representative of Honorable President of the country in the Board of Governors of IGNOU, that is the first open national university of the country. Sir is a strong advocate of technology and innovation for having efficient healthcare systems and has a deep interest in creating and developing software products and applications to achieve time and cost efficiency at the same time. Dr. Shetty has, to his credit, US patent registered as inventor and a recipient of the Apex Awards of the nation, that is Padam Bhushan, Padam Shri. In addition to this, the Economist Innovation Award, Financial Times, ArcelorMittal Boldness and Business Award, Nikkei Asia Prize for Economic and Business Innovation, to name a few. Sir has also been awarded honorary doctorate from University of Minnesota, IIT Madras, and IIT Kanpur. On behalf of you all friends, I would like to welcome Sir for hearing from him with his vast experience. And for your reference, sir, we have now more than 350 independent directors pan-India who are attending to this conference. I'm sure the figure will go up. Over to you for your discourse, sir. Sir, you need to unmute, please.
Sorry. Thank you so much, Dr. Gupta, for the very, very gracious introduction. I'm extremely grateful. I would like to start off with the wish list. As a person running a stock market listed company, what do I expect from an independent director, first of all? First of all, I mean, apart from the regulatory requirement from an independent director of taking care of the interest of the minority stakeholders and the integrity and the other regulatory requirements, from the business aspect, we generally like to have independent directors coming from different sphere of life rather than healthcare. We do not want to have many more healthcare professionals as our independent directors, because business scenario is changing constantly, and we want to have different outlook, different idea, different thought process from our independent directors. And also, we expect our wish list for the independent directors is to be very, very progressive and think 5 years, 10 years, 20-year horizon than the next quarter or the next 2 quarters. That doesn't make much difference to us. We are not in the game of valuation. We are here to build a company for the legacy. I would, as a doctor addressing all of you, especially a doctor dealing with the heart, I thought I should spend 10 minutes explaining to you how to take care of your health. I hope you would like to hear from me. First of all, the way healthcare is delivered today will undergo dramatic change. Today, the opinion all of you have is that see the doctors when you are in pain, and doctor will address your problem. That will change dramatically in the years to come. It will change to see the doctor every year, once a year, and get all your tests done. Now, the important message I want to give you is that Dr. Gupta, can I request you to put me on the main screen so that I can show something about the heart?
Okay. Ashish, can you help us on this? Can we have it in the center of the stage? Yeah. Can you check it, sir, now? You are at the center.
Okay. No, I can't see it, but as long as people can see me, I just want to show you something. Yeah.
Friends, can you see him in the, in the center screen? Okay. Yeah, they can see you, sir.
Sure. Thanks. So the message I want to give to all of you is that how fit you feel has nothing to do with how fit you are. If you want me to say that you are a fit person, you would have climbed Mount Everest twice in a month. But I still cannot certify you as a fit person unless I see the numbers. Your fitness is nothing but your numbers. Now, what are those numbers? Every year, I would like to know what your blood pressure is. I would like to know what your blood sugar is. I want to know your lipid profile is, thyroid profile is. I want to know your heart numbers. I want to know your liver numbers. I want to know your kidney numbers. And I would like to see the images of your heart, your kidney, and the liver, and the other vital organs. Today, technology allows you to get all this information in just 60 minutes. It's possible. Technology is available. A lot of the time, when you read about a young executive in his 40s running a marathon, drop down dead, huge debate happens. Why this happened? But nobody has ever written or discussed that the person who unfortunately died had a CT scan of the heart and an echocardiogram and a ECG, just 3 tests, one about 10 years earlier. This death could have been prevented or anticipated. I haven't come across in my life nobody ever dying due to cardiac arrest with normal heart. It simply doesn't happen. I mean, it may happen once in a million, but it simply doesn't happen. So it is very, very important that everyone, irrespective of how fit they feel, must go for a preventive checkup. And 99% of the time, there is no problem. The fear what people have is that if you go to doctor, they will find something, then I may have to undergo unnecessary procedures or the treatment. Believe me, it is better doctors find something wrong with you at an early stage. Because at an early stage, virtually most diseases can be cured. If you cannot cure them, at least you can give them a meaningful life. But end stage of the disease, it doesn't matter how many millions of dollars you can spend. Whatever you do, in the end, consequences, the results are not up to your expectation. So this is my message. My message to all of you, please get your health screening done once a year. It is painless. It can be done within an hour, and that will and have all your medical records in your own phone. This is my first message. Now, coming back to the my profession of a doctor and running a group of hospitals, I have a very, very strong prediction about the future of the country. I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. You may think it may take 50 years, 100 years. No, it is going to happen within the next 5 to 10 years. Why I am confident that India will be able to do this, something which even the first world countries couldn't achieve. The reason is, with all the government policies and the initiatives which have happened over a period of many years, we have all the pieces of the jigsaw puzzle to finally give the shape of a beautiful picture. We are the pharmacy of the world. We produce the largest number of doctors, medical technicians, nurses in the world. We have everything going. Our only missing link is people do not have the money to pay for the healthcare. But that is going to change. That is going to change because since independence, we have been reading, hearing from all the policymakers that healthcare should be available to people free of cost with the taxpayers' money. This is a wishful thinking that it is the government responsibility to offer healthcare free of cost to everyone. But there are very, very, very few countries in the world which has proven that it is possible to offer universal healthcare for free with the taxpayers' money. And there are three things common with these countries. All these countries are small countries with a population of 1 lakh, 1 million, 2 million. The moment it exceeds 20 million, they start having problems. You can see what is happening with National Health Service of England. It is very, very, very difficult for large countries to offer healthcare for free with the taxpayers' money, including United States of America. There is not even a single country, a large country has done it, including United States of America, richest country in the world. Then you can imagine where we are. The second common thing with these countries, all these successful countries have a very high tax to GDP ratio between 25% to 45%. Our tax to GDP ratio is about 11.5%. Our government simply don't have that kind of resources. And the third thing which is common with these countries is that they're already spending more than 10% to 18% of the GDP on healthcare. Our government is hardly spending about 1.2, 1.5% of the GDP. We simply don't have that kind of a resource. But we have many strengths. Our strength is 1.4 billion people. We have done a lot of things in this world which is unimaginable, unthinkable. We have gone from no TV, no radio, to color TV with few hundred channels in less than 30 years. We have gone from no phone to the most modern mobile phone in less than 20 years. We have dissociated entertainment from wealth. Today, people living in the slums of India have access to all the fancy channels and Netflix and Amazons of the world. This is predominantly because of our numbers. I have seen there are countries which are considered some of the wealthiest countries in the world with per capita income almost as much as US, where nearly half the country's population do not have data in their mobile phone. They can only talk. They cannot use the internet because data is very, very expensive. Whereas in India, even the beggars have data connection in their mobile phone. And we will be doing the same thing in healthcare. How that magic will happen is in India, everyone will have a health insurance. Some of them will be covered by the government as they have done a good job in covering nearly 40% of the population. But rest of them will have a private health insurance or an employer's health insurance. We have 100 million families which can afford healthcare without any insurance support. We have another 100 million families who are directly or indirectly associated with the first 100 million families. If this 100 million families who are generally earning between 20,000 rupees to 60,000, 70,000 rupees per month, if they can have a health insurance, we would have covered the healthcare of the whole country. Now, what is the requirement of these countries? This population, the requirement is they need affordable health insurance. Indians, working class Indians, cannot afford health care, but they can afford a affordable health insurance. So we are grateful to Insurance Regulatory Authority of India, which gave us the license to become a health insurance company. We are the first hospital in India to become a health insurance company. Now, you may be wondering, why hospitals should become a health insurance company? I will give you the reason. About 16% of the heart surgery done in India is done by our group. More people develop heart attack, it is better for my business. I have absolutely no incentive to prevent people from developing heart attack. But when I become a health insurance, my priority will dramatically change. I will work very, very hard to prevent people from developing heart attack and heart disease. If the people are healthy, I will save money. If the people develop heart attack, I will lose money. Today, when I tell a patient that you need bypass grafting, first thing what goes to the patient's mind is it really required, or this doctor wants to make some money out of it? But when I become a health insurance company and I tell the patient that you need a bypass grafting, he will smilingly agree because I'm going to pay for the operation. My interest and the customer's interest will be aligned. Then the magic will happen. We have launched our first insurance program, a insurance policy called Aditi. Our desire is that a working class families, a family of 4, father, mother, and 2 children, should be covered for rupees 1 crore. 1 crore rupees coverage should be given for any type of surgery, including heart transplant, kidney transplant, bone marrow transplant, any of the procedures. And for medical treatment, they should be covered up to 5 lakh rupees. And you may be wondering how much is going to be the premium for covering the whole family. We have kept the premium at 10,000 rupees per year. We are confident as a hospital group, we will be able to offer healthcare to all our members, coverage up to 1 crore rupees with a premium of 10,000 rupees per year. Now, we are trying to, even 10,000 rupees is a lot of money for most of our working class families. Now, we are trying to get some government bodies to help us to create a health saving account. In Singapore, in many Asian countries, and in the US, health saving accounts are very popular. How this works is, I have a maid, I have many maids, I have chauffeurs, I have gardeners, many people working in my house. And every festival, or when they work overtime, or my driver comes very early in the morning to pick me up from the airport or drop me at the airport, I always give them some tips. I may give 100, 200, whatever money I want to give. And these people will simply spend the money for virtually nothing. I want all of them to have a health saving account, and that money can be spent only on buying the health insurance. Not necessarily my company's health insurance. They can buy any company's health insurance. If we can have a health saving account for everyone who are helping us directly in our household, believe me, 100 million to 200 million households will be, nearly 100 million households will be supported. Because over a period of 1 year, I'm sure most of these people will receive a gift or the kind of a gratuity from people like us to the tune of about 5,000 rupees. Then all they need to spend is another 5,000 rupees. And essentially, it is very important that we belonging to the first 100 million families somehow induce the second 100 million families about the power of health insurance. It is an amazing tool. There are 40 auto drivers in front of our hospital, flying our customers wherever they want to go. And we are in the process of offering them health insurance. And a donor has come forward to help us. The idea is that this 40 auto drivers family will be covered up to 1 crore rupees. Together, they will be covered up to 40 crore rupees. They have an assurance of somebody paying them 40 crore rupees if they require care. This is the power of amazing tool called health insurance. And all these tools are going to make a huge, huge difference in making this country reach towards the goal of dissociating healthcare from wealth. Now, we also have a prediction that contrary to everyone's expectation, cost of healthcare will go down dramatically. But revenue of the hospital will double or triple over a period of time. How this is going to happen? I'll give you one data. India requires 70 million surgeries a year. Now, if I ask you how many surgeries are done in India, you'll be surprised and shocked. No, we do about 20-25 million surgeries a year. The rest of the people suffer with their surgical condition without treatment because they simply can't afford it. Once these people are covered by health insurance, they will be standing in queue in front of the hospital. And if we have to double the number of surgeries what is done in India very quickly, you cannot double the number of beds. Today, each hospital bed costs 2 crore rupees. We simply don't have that kind of a resource. But existing hospital, if they change the way they work, they can double or triple the turnover. First thing they have to do is to remove the pen and paper from the hospital. Have an advanced digital platform where everything, the doctors, nurses, technicians, machines, patients, everyone gets connected on a digital platform. When that happens, the operation becomes seamless. The patient safety increases tremendously, and patient experience will be dramatically different. And this is the way we are envisaging, and we are invested millions and millions of dollars in developing this platform. And all our hospitals are virtually paperless. Now, we would like any hospital, 80% of the hospitals across the world do not have electronic medical records because it's very, very expensive. We would like any hospital anywhere in the world to use our platform at a price what they can afford to pay. And if they don't want to pay, that's okay with us, as long as they use it. Because we have developed this huge platform over a period of 20 years, spending millions and millions of dollars, and that is serving our purpose. This is the beauty of converting atoms into bytes. If I have 1 kilo of rice, I give you half a kilo of my rice. I lost my half a kilo of rice. I have developed this electronic medical record, hospital management system with the analytic tool for my patients, and we are happy with what we have. I can afford to give you a copy of that. You can use what I have. I still what I have. I haven't become poorer by giving you what I have. This is the beauty of technology. So all these technological evolution and revolutions which are happening will dramatically change the way a patient, a person consumes healthcare. Most of the primary care will shift from the doctor's clinic to the patient's house, and it will go the online route as long as the patient has all their medical records on their phone. And that will allow most of the diseases to be diagnosed at a very early stage. And when the diseases get diagnosed at an early stage, the result of treatment becomes excellent. We have proven that the diabetic patients whose diabetes is managed online have a much better control of the diabetes than the patient who like to visit the doctors at regular intervals. Most of the chronic diseases will be managed online. I think I have finished most of the things what I wanted to discuss, and I'm happy to answer any of your questions.
Thank you, sir, for this insightful session. Dr. Gupta is joining shortly. So meanwhile, I invite participant to please raise your hands so that we can accommodate your questions. Mr. Kasha Sai, please come in. Please unmute yourself.
So, thank you, IICA, for this wonderful meeting, and thank you, Dr. Shetty, for your amazing work and the initiative. In terms of a boardroom, I have a question, sir. So, how about is there any plan that physical and mental health that could be included to the directors, to the board of directors, which has a lot of consequences to the companies as well. I'd like to hear from you, sir.
Yes. See, the mental health issues are a very, very pressing problem in India, not only for the board of directors, it is for the whole country. Unfortunately, not much of attention has been given to this. And also, unfortunately, India is extremely short of psychiatrists and psychotherapists and counselors in addressing this issue. This is a big issue which has to be addressed. But good thing is, unlike in the past, patients are not ashamed to say that they have consulted a psychiatrist or a counselor. And that is very important. And today with the online route, if somebody wants to remain private in terms of consulting, that is also available because most of the psychiatrists would like to see their patients online. So this is an avenue where a lot of activities are happening, and it's a matter of time before we will come up with a very good solution. Thank you. Thank you.
So would be possible to connect with you on this regard? Because I myself personally went through a lot of challenges and, coming out, and I could see, we can build certain indicators or something which could able to help people,
Sure. Definitely. I will pass on my email and you please stay in touch. Yeah. Thank you.
Mr. Manas, would you like to come? Mr. Manas, please unmute yourself.
Sir, this is Manas Pandey. I am a visiting professor. Sir, my question is, sir, how do we really instill or promote a corporate governance in Indian companies? If I look at and compare it with the international companies, we have a lot of space to cover. How do we instill this, and how do we create an effective board? I mean, from your perspective.
Yes. Yes. See, thanks a lot for asking a very sensitive question. I must admit, we have come a long way. We have come a long way, but we have a long way to go. The most important aspect is the integrity of the promoters. That is very, very important. When I hire the chief financial officer or one of those important people in my company, I generally ask them at some point of time, if the company is in distress, if I ask you to do me a favor by allowing us to do something which is not legal, will you do it? And so far, all of them, without any hesitation, they said no. Even if you beg me, I will not do it. Because if I do it, I'm not your friend. Because one day or other, you will land in trouble. And it is rather better for you to go through the difficulties now, rather than trying to find a shortcut to come out of the mess what you are in. So this is the level a promoter integrity should be, and that should be conveyed to the board members in the beginning itself. And also the board members, when they accept the position of an independent director, must make it clear to the promoters that this is what they believe in, and the promoters must respect it, so that there is no misunderstanding in the end.
Very good. Yes.
Thank you. Next, please, Mr. Ramakrishnan Mudre. Sir, I can see, Dr. Shetty, I can see a number of raised hands, but I'm not going to accommodate all the questions. So just would like to know how many more minutes do you have accordingly?
Yeah, another 5 to 10 minutes is okay.
Sure. I'll take care of it, sir. Then Mr. Satyajit Ghoshal, would you like to come in? Or Mr. Ravindra?
Hi, good afternoon, Dr. Shetty. I think it has been very interesting to know about the Aditi launch, that your hospital and you have taken initiative in doing that. My first query is with respect to how you would ensure the reach of this very innovative scheme to pan India. So would you be my understanding is that it's through Narayana hospital groups only, and I really do not know how well spread that is. So do you have any plans of associating other hospitals with the scheme so that it reaches the large number of people? And secondly, question is that if you have been able to do, what is your view that why other big group of hospitals are not doing this, which looks to be a very, very interesting proposition that has come to surface? Thank you, sir.
We are initially launching the health insurance around our own hospital, so that it's a very local affair, because we want to learn how it's going to pan out. So the idea is to first launch in Karnataka, that too in Bangalore, initially in Mysore, now in Bangalore. Eventually, we will be, after some time, we'll be launching it in West Bengal and other states where we have the presence. Initially, we are, I wouldn't say restricting it. We feel most of the customers are our own customers. But eventually, we will be opening it to all the other hospitals and rest of the country as well. It is a learning. We have never run a health insurance before. It's a learning exercise. And we want to do it very cautiously. We will not be launching it pan-India right away. That is not the way we expect our insurance program to run, because we are primarily healthcare providers. We are not financial institutions. So our desire is to make sure that we not only offer health insurance, we also take care of their healthcare. So that is very important for us. And about your question, why other hospitals are not getting into it, they will be watching, and I'm sure once our insurance model works well, I'm sure they will also be interested to get in. It is a risky business. All of us have to understand that today, the moment you become a health insurance company, there is some risk involved in this procedure, in this game. Yeah.
Thank you, sir. Ms. Sudha Ravi, would you like to comment?
May I comment? This is Mudra.
Yes.
Yeah,
yes.
please.
Yeah. Namaste, Mr. Devi Shetty, Dr. Devi Shetty. It's wonderful to see you here in this platform. And I come from Mysore, where your insurance this thing is covered now. And I have two questions actually. One is the health of the board. Now, I'm on the board as independent director in one of the public sector companies in public limited companies in Mysore. Now, I see my physique as a tool and my fitness as a resource. When the board is looking after the health of the company, and it is very, very pertinent to see that the board members look at their health also. When I want to sustain my service, whether as a board of director or as a doctor or in any NGO where I'm working, I look at myself and my fitness as a resource to sustain the services what I've been delivering. Now, it has to be mandatorily it has to be seen that every director undergoes, for the benefit of the stakeholders, his own health the examination every year. That has to be mandated. That's one thing I wanted to. The thing probably it has to be a culture in every company that all the directors undergo their annual health checkup. As you are very, very correctly telling that, find out if there is some negative element in the body, find it out at the earliest. And being a volunteer in palliative care for the last 12 years, I understand this very, very clearly. My physical fitness is extremely important to sustain my services. The second point is that my experience, I just put it on the chat, the coverage for children with special abilities, it is not adequate. When we are talking about access to quality medical care, whether it is available to special needed people, and how we are able to do that. This comes from me because I am a parent of a special child for the last 34 years. It was a small accident in the hospital about 34 years back, which rendered my child invalid for life. She's cerebral palsy with mental retardation. And I was very much interested to see that she is also covered in my family floater. For some small amount, she is covered now. And I applied for Aditi insurance in the month of June. Kindly do not take it in a very personal fashion. This is on the experience what I'm sharing with you, so that many more parents of special children will be helped. So I came to understand there is no special scheme available to cover people with special needs.
Yes.
And also being a parent at the age of 69, I claim myself to be very fit. And my wife and I, we are taking.
Krishna, the question, I think Dr. Shetty has clarity about the question. I think we should hear from him.
Yeah, this particular question is, can there be a special package for this, people with special needs? Yeah.
Thank you. Thank you. See, the special needs, we have planned for health insurance for the senior citizens. We have plans for the health insurance, top up, many things we want to do. So we are just starting our journey, and we didn't want to get into areas which are not the standard areas for the insurance to cover. Our desire is to really make a difference to the deserving group of people, like what you talked to me about your child. So we will definitely do it, but give us some time, because we now are dealing with the financial instrument, which is very rigidly governed by the regulatory bodies. So whatever we do, the clearance takes a long time, and we should be very clear about what will be able to cover. So these are the issues which right now I don't have the answer, but our heart is there in terms of helping children like you. We are like your child. We will definitely look at that. Thank you.
Great, thank you. Friends, I can see the level of enthusiasm, more than 30 hand raises I can see, but in the interest of time, one last question I'm accommodating. Ms. Sudha Ravi, if you would like to comment.
Yeah, thank you very much, Doctor, for this illuminating talk. At the outset, my questions are very different in the sense that while insurance is something which you are introducing now in Aditi, what about all the other insurance companies which are there? How are you going to technically evolve them so that the patients are not put to a problem? Invariably, the problem comes in when the patient is getting discharged, or after the admission, they are not getting through because of this. Is there something which technically, through your IT, AI, is it something which you can work with the other insurance people so that this issue doesn't come up every time a person is admitted or discharged?
See, we will never cover any person unless that person has undergone a medical checkup by us.
Yes.
Now, why we want to do that is because we have screened you and we said we will offer you the insurance. Then at the time of discharge, I can't say that this is not allowed, this we didn't know, or you didn't declare, you didn't say you're a diabetic, or you didn't say you have this problem. That is the main reason why health insurance members land in trouble at the time of discharge. So we are not a financial company running a health insurance. We are a healthcare company. So our view about health insurance is dramatically different than a regular insurance. Now, whether we would like to work with other health insurance company, we can definitely help them if they want us to. We have no problem. But we don't have any control over how others are running. But as far as we are concerned, we know that we would have covered people after knowing them in detail about what kind of a state of health they are. And we have accepted that these are the people who are vulnerable for this problem, and we are mentally prepared. Yes.
Doctor, what I meant is, for example, let me not take any names of the insurance companies. A person comes to Narayana Iridalia for their stent, coronary bypass, or whatever it is. What happens invariably is you're putting them in specific stent, which is qualified by the insurance company. the room rent is qualified by the insurance company. But after that, when the final bill comes in, there is a vast difference between the two. Although there is an arrangement between the insurance company and your hospital that this is what is going to be charged, but the patient suffers in the end.
Yes.
I have been on board of hospitals, and I find that this is invariably causing some amount of trouble for all the patients who enter. That's the
I
main
agree
reason
with
I
you.
asked.
I agree with you entirely. We go through this every day, and our patients think that we are not helping them or we are exploiting them. We are only the intermediary between the patient and the insurance company, and they do not have any access to deal with the insurance company directly, but they deal with us. So
Yes.
this is one of the greatest motivation for us to become a health insurance company. Yeah.
Okay. You can't find out a way of using your AI to give more information to these insurance companies who are going to cover with the policies? That you have to do these
I
things?
feel they have capability of getting any tool.
Okay.
I am still not able to understand how these things work in the regular insurance company. It's a bit complicated for me to understand. Yes.
Okay.
Yeah.
Thank you
Okay,
very
thank you, Sudha. Friends, as I mentioned, I regret I cannot accommodate more questions because Dr. Shetty has to leave. However, those who have a question can mark me their questions over the mail, and I'll try to put it before Dr. Shetty through his office. And definitely he would love to, I request to answer some of the questions which has a larger interest. So with this, I'm closing here. Big thank to Dr. Shetty for sparing his valuable time. I understand the cost of each minute. Thank you once again. And thanks to all the friends who have joined, asked excellent questions, and again have questions. I can see a lot of questions coming in the chat box, and we'll try to address them as and when possible. So thank you so much, sir.
Thank you. Thank you. Thank you so much. Thank you.